Hello everybody, this is Dr. Mohammad Alimuddin from FDRS 7th Global Update, Hotel Marigold, Begumpet, Hyderabad. Today, it's my honor and privilege to introduce my dear friend Dr. Swaraj. Sir is a senior faculty of diabetes. Sir works at Department of Diabetes and Medicine as a professor at MNR Medical College. Sir is also the director of Anugraha Diabetes Center. And today we are going to talk about a very important topic which is coming in the near future. Fasting has been part of all religions all the while, but especially in Ramadan with more than a billion people fasting, many of us are unsure and unaware of many things. So, sir, I would like to request you to talk about Ramadan and diabetes today. To start with, please let us know who can fast and who cannot fast.
At the outset, I'd like to thank Dr. Faraz Farishta sir for this kind invite and Dr. Alimuddin for giving me an opportunity to share my small experiences with respect to diabetes and fasting, especially during the month of Ramadan. Sir rightly said that a quarter of the world's population is they fast during this holy month of Ramadan. So it is one of the 5 pillars of Islam wherein fasting is mandatory. At the same time, as the number of people with following Islam is increasing, number of people with diabetes is also increasing. So we have to make sure as a healthcare provider that we give them the proper environment to fast. So fasting is one of the 5 pillars and it is mandatory to all Muslims. Also, that doesn't mean that nobody is exempted. So we have to be careful who can fast and who cannot fast. So most of the people with diabetes can fast. We should be very clear about it. We should not be, as a healthcare provider, we should not be hardline to say that no, you cannot fast just because you have diabetes. At the same time, we cannot say that everybody with diabetes can fast. So we have to find a middle path somewhere so that we can convince them. So our criteria would be first, when I suggest somebody whether they can fast or not, is whether their HbA1c is under good control or not. How was the previous experience while they were fasting during the month of Ramadan? Did they have any severe hypoglycemias or hyperglycemias during that month? So to put it in a small simple nutshell, people with well-controlled diabetes, shorter duration of diabetes, when I say well-controlled, probably HbA1c of less than 7.5 and a shorter duration of diabetes and without any significant macrovascular comorbidities or for that matter even microvascular comorbidities. For example, mild NPDR is there, patient wants to fast, HbA1c is under well control, yes, definitely they can fast. At the same time, a 70-year-old individual with a CKD and a CAD and diabetes which is not under good control, then probably fasting would not be advised to such sort of people. At the same time, we should make the boundaries very clear that yes, below this side you can definitely fast and more importantly you can safely fast. Second, on this side of the line, we tell them that reconsider your decision to fast. I do respect that you are supposed to fulfill the requirements of being a Muslim, but that doesn't come at the cost. So what the religious guidelines say is somebody who is ill, somebody who is traveling, somebody who is pregnant and somebody who cannot fast because of the circumstances, they are exempted from fasting. So we should teach them that because they will be very disappointed if we tell them not to fast. So if I am telling them somebody who is coming, no, you cannot fast, they'll take it in a negative way. So we have to tell them that it is worth reconsideration your decision to fast if you are not meeting the required criteria. I think this should be far or more or less in a nutshell how I would approach a person who would want to fast during the month of Ramadan.
Awesome. Thank you, Dr. Swaraj. Fasting is a very emotional decision for everybody, and fortunately we have very clear guidelines of IDF, Diabetes and Ramadan Alliance, which say whom to fast and whom not to fast. Yeah. They are putting the yellow light, green light and red light very clearly. I am thankful to you, sir. So my next question to you would be, what would be the basic pathophysiological changes that happens in a diabetic patient during the Ramadan period?
So the main important thing that we consider here is the eating patterns, because probably they would go from morning 4 to evening 7. That's roughly around 13 to 14 hours of 14 hours in a day without any calorie consumption, and no fluids are also consumed. So this leads to various, and plus also the sleeping patterns are also changed. The exercise patterns are also changed. People who are regularly exercising. So we have to consider this. So what usually happens is the cortisol levels rises. This cortisol level which rises can lead to increased glucose output because it decreases the insulin sensitivity. The adiponectin levels, the leptin levels also do change. So we have to address this. And our criteria would be mainly to make the patient comfortable while they are fasting and give them a very clear guidelines how to do the dose adjustments. If the patient is taking insulin, which insulin he has to take, what is the dose reduction that he has to do at suhoor and at iftar, how much of the insulin needs to be adjusted, and what kind of food they should be consuming at the iftar where they are probably fasting for 14 hours. The one thing they should avoid is feasting at the end of fasting. I think that should be the approach that we should be having.
Thank you very much. So, as sir said, disturbance in circadian rhythm disbalances or imbalances the hormonal rhythm in our body, which leads to many problems. So, for this, your physician will adjust your doses accordingly. So, my next question to you, Dr. Swaraj, is when is the right moment for the patients to get screened for the
Yes,
diabetes?
it is very, very important that patients who want to fast, it's not like if tomorrow the fasting is beginning, they come today. So we cannot train them adequately. So what I usually do in my practice is, because we would be knowing when the month of Ramadan starts and when the fasting would be starting. So 4 to 6 weeks, or at times depending on the glycemic control, probably around 8 weeks, we tell them, okay, now Ramzan is coming, you should do the adjustments like this, you should take your medicines like this. Make sure that you have a pre-Ramadan HbA1c to tell the patient, yes, now your HbA1c is 7.2, you can comfortably fast. So that motivation to the patient to start roughly around 2 months prior to the onset of fasting. Not like 2 days or 4 days just before the Ramadan begins and then you say, no, it's difficult. So that becomes a little tricky. So 2 to 4 weeks before, and make sure that the patient has a pre-Ramadan HbA1c, and seeing that pre-Ramadan HbA1c, the patient is also motivated. He says like, yes, good, my HbA1c is under good control, now I can fast comfortably and safely. So that needs to be addressed. So the education begins roughly around 4 weeks prior to it, and the training kind of a set begins around 3 to 4 weeks before the onset of Ramadan. Not a couple of days before, for sure.
Yes, thank you very much. Now, Ramadan, as we know, is a month of entire fasting, and we have seen that intermittent fasting does lot of wonders, especially to diabetes patients,
Yes.
increasing our insulin sensitivity,
Yes.
taking care of our weight. But like sir said, feasting after the fasting is one damage that happens and ruins the entire month of Ramadan.
Yes.
So, what are the common pitfalls one should avoid during the Ramadan, sir?
Sir, as you rightly said, feasting at the end of fasting should be avoided. We very well know that after 14 hours of fast, it is human tendency to make sure that you consume a lot of food. So, how that can be avoided is you consume little and small frequent meals. So, at iftar, you take probably a couple of fruits that are allowed. For example, you can take watermelon or you can take a apple, break the fast and relax for some time, and then have a small snack. So some people consume iftar and their meal of the day, that is the evening meal of the day, during the same time. So that should be avoided. So iftar, break, a small snack, and then probably after another hour or so you can have your last meal of the day. So that would be the approach. Make sure that you do not consume more amount of fried foods. Avoid consuming too much of sweets, just that you are fasted for 14 hours. That doesn't give you the absolute liberty to have a high carbohydrate food. So limit and in moderation, if you can have carbohydrate and lipid or fatty foods, that would be beneficial. At the same time, make sure that your protein consumption is pretty good. And last but probably not the least, a very important thing I would like to consider is maintaining an adequate hydration. So evening 7 o'clock to morning 4 o'clock, you are supposed to consume good amount of fluids so that you do not land up in any problems associated with dehydration. That is of very important and most oftenly neglected.
Now I would like to ask you the final question, like how do people exercise during the month of Ramadan when they are fasting?
That is a little of a tricky question because for somebody who's a regular person who is exercising on a day-to-day basis, giving around 45 minutes to 60 minutes per day to fast, I wouldn't suggest him to change his regimen. So what they can do is, anyways, that seher they would be having they would start their day with the morning prayers. So after the prayer, they can go for a walk of around half an hour or 45 minutes. Probably the intensity can be reduced by around 30%. And if he is not comfortable with that, at the end of the day, after iftar and after the end of the day, he can take a walk or probably hit the gym for around half an hour, 45 minutes. If that is comfortable with him, but the intensity should be reduced by around 25 to 30%. So that would be my takeaway.
Yes. Thank you very much, sir. Today we have come to know that to fast or not to fast is the prerogative of your doctor. Please go to him before at least 2 weeks and get your HbA1c checked. Second thing, to stop feasting about the fasting. And third thing, take adequate water levels, maintain your hydration.
Yes.
And most importantly, exercise should be decreased and it should preferably be done after iftar during the night times. And everyone who is watching this video, take care of your diabetes so that it can take care of your Ramadan. Thank you very much, Dr. Swaraj sir, for being a part of this.
Thank you for inviting me on. Thank you.